So our company, Rapid CPAP, came up with a great solution to an age-old problem, and that's respiratory telehealth. For many years, respiratory therapists have gone to patients' house to take care of them. And we certainly still do that. That's our business and that's what we do. But this is just a new tool in our toolbox to be able to take care of the patient immediately. Many patients do not want unnecessary people coming in their home for a very good reason. There's no more susceptible person in the world than a hospice patient. How many hospice nurses out there have had a situation where you have a patient who's short of breath, and to be honest, you just don't know what to do about it? And you wish that you had somebody who knew about respiratory therapy, respiratory devices, respiratory disposables, just respiratory in general, and you wish you had them in your back pocket. Respiratory telehealth is like having a respiratory therapist in your pocket at an extremely low cost. Let's now take a look at a typical hospice patient interaction. At this point, the patient's beginning to feel anxious and short of breath. And I'm not sure if anybody's experienced that before, but it is a terrible feeling. The daughter, who is also the caregiver, is really starting to get upset and decides to call hospice. When the nurse arrives, she begins to evaluate the patient, and she realizes that she's having trouble pinpointing exactly where the shortness of breath is coming from. She now realizes that she needs to get respiratory therapy involved. So the quick and easy answer to this shortness of breath issue, respiratory issue, is respiratory telehealth. It takes moments to get a live respiratory therapist when, in all actuality, it takes hours and maybe sometimes days for a respiratory therapist to come out. It's not for every patient. And not every time are we going to be able to avoid having a respiratory therapist come out to the house. However, it's a great new solution to a very old problem. The type of patients that benefit the most from respiratory telehealth, in our experience, are ALS and chronic lung patients. The real truth is, respiratory telehealth is the future, and not only the future, it's the now. Patients do not want unnecessary clinical people in their home. Hospices do not want to discharge their patients to another hospice or off of hospice altogether. Respiratory telehealth is a valuable, valuable tool that your nurses can have in their pocket as they go out to see these patients. I would love to have a conversation with you. Please contact me to begin rolling out respiratory telehealth in your hospice.